When you examine someone with a scoliosis, there's always two things that you find: muscle tension and joint restriction on the outside of the curve. Now this will cause pain in some people, but can also set you up for problems later on in life. So these are the best exercises that can help with both pain relief and minimizing the impact of your scoliosis on your health. A scoliosis can be C-shaped, S-shaped, or even have three curves. If you know where the curves of your scoliosis are located, you can target that level with these exercises. But if you're not sure, or the curves continue all the way up your spine, just do all four exercises. Exercise 1. This first exercise is for people with a curve in the lumbar spine. These people might notice one hip higher than the other, or pain or tightness on the outside of the curve. The main distortion with scoliosis is a bend to the side, so we're going to work on that first. On your hands and knees, with your spine neutral, not extended, slowly tilt your mid-back to one side and your neck to the other. You'll feel the muscles on the outside stretch, but keep within a pain-free range of motion. Then slowly move to the other side. Keeping the spine neutral will target the upper lumbars, and flexing the spine slightly will target lower down. Repeat 10 times slowly. If your curve is milder and you feel stiffness but not pain in your back, you can try this stronger variation. On your side with your knees bent and your hips forward level with your knees, lift up until your spine and legs form a straight line. Hold for a few seconds and then slowly lower back down to stretch the muscles on the down side. Repeat 5 times on each side in the pain-free range of motion. Exercise 2. The second biggest distortion in scoliosis is rotation, so let's work on lumbar rotation next. Lying on your back with hands flat on the mat or bed, bend your knees and slowly rotate from side to side. Again, keep in a pain-free range of motion, but you can go as far as touching your knees to the mat. Repeat 10 times slowly. Exercise 3. The next exercise is for people with a curve higher up in the thoracic area. These people might notice uneven shoulders, one side of the rib cage or shoulder blade that sticks out, even one breast a different size to the other. To work on the side bending component of the scoliosis, we simply stand with legs wide and run our hands slowly down one side of the leg and tilt our head to that side until we feel a nice stretch. Then slowly move the other way. Repeat 10 times slowly. Variations. If you lift the opposite arm up, it'll stretch the latissimus dorsi too, which can be tight in more pronounced curves. To increase the intensity, you can progress to side bends using a door frame. Exercise 4. To address the rotation component of thoracic curves, we start off in the sitting position, reach behind with one hand, and gently stretch around, looking behind us. Just keep the spine upright, not slouched. Hold for 5 seconds, then do the other side, and repeat 5 times in each direction. Alternative. To add more of a strengthening component, begin in the 4-point position, reach down and under your other arm as far as you can comfortably, then right back and up in the opposite direction. Hold each position for a few seconds and repeat 5 times each side. Try both of these rotation exercises and just use the one that feels like it gives you the best stretch. Bonus exercise. If you've got a lot of rib protrusion and you tend to get stiff and sore in the rib cage, I'd recommend a minute a day of rolling on a foam roller too. Just make sure that you support your head with your hands in a neutral position. This will mobilize the joints where the ribs attach onto the spine, an area that's often restricted in patients with scoliosis. Now there is one other thing that you need to be aware of. If you have a pronounced thoracic scoliosis, this can cause a winged scapula, where the bottom of your shoulder blade sticks out. Now, if you watch my videos, you'll know that a forward tilted and internally rotated scapula can heavily predispose you to shoulder problems. So if your shoulder blade sticks out a little bit, head over to my video on fixing shoulder problems and learn how to prevent yourself from having shoulder issues. It's important to understand that 80 to 85% of scoliosis cases fall into one category, the idiopathic scoliosis of unknown origin. Now, for some reason, as we grow from a very early age, from the early teens or even before, the spine can grow with a bit of a bend in it. And by the time we reach our late teens, when our bones are fully matured, the vertebrae have changed their shape permanently. You can't change the shape of bones once they mature, so most people can't straighten their scoliosis. But on top of this bony distortion, you can get a postural distortion. So some people with an idiopathic scoliosis can get a bit of straightening of their spine if they deal with the postural component with things like these exercises. And people with the functional scoliosis can actually straighten their spine completely. Regardless of which type of scoliosis you have, these exercises can help you deal with the muscle issues and the joint restriction. Just please note that if a child has a scoliosis and is still growing, they need to be checked by a professional regularly. But that's it for today. Hope you liked the video. If you did, please like, comment or subscribe to support the channel. Thanks.